I just want to emphasize that even once we're past the peak of this first wave and on the downward trend on the other side of the curve, it will be equally critical to keep up with our control measures. If we let up, new chains of transmission will take off in our highly susceptible population, and the epidemic will reignite. If we are to not lose our hard-won progress, we must stay the course until we have reached a very low number of cases at the bottom of that first wave. However, even with epidemic control, we anticipate that some public health measures will need to remain in place to prevent the growth of future smaller waves. We don't know if we've reached a peak anywhere in Canada as yet, so it is too early to tell, and we've got to really look very carefully day by day at where the trajectories are going in different parts of the country. We will not know that we've passed the peak until retrospectively we will know. On the downward side on the curve, we cannot let go of any of our public health measures. The moment you release anything, the chains of transmission is going to ignite. So you're going to have to get that initial epidemic to die out, to stamp it out. And so at the end of which, things have to be recalibrated. So as I said, we are going to look towards countries that have gone before us to learn, if they are beginning to relax their measures, what they might be doing and learning from their experience. At the same time, I think right now is a period of time when across the country we're coming together to say, well, how do we determine the effectiveness of our public health measures? How do we determine the potential negative consequences of the measures that we've already taken? And then how do we very cautiously potentially lift some of them, depending on our data and what that shows at that time? All I can say is that it will be a very cautious approach because right now the population is susceptible. So anything that we do must not reignite another chain of transmission. So, I can't be extremely precise with the timing of that. But again, everything that we do now will shorten that period of time.